Good day, my name is Stephanie Claire Ascaro from BSN 12C, and today I'm going to perform hand washing procedure. It is the process of cleaning both hands using soap and water to remove microorganisms and prevent contamination. So first is we're going to check the supplies. Okay? It is to ensure that all the equipment that is needed is present during the procedure to consume time and energy. So next is we're going to stand in front of the sink, and we must remember that our uniform must not touch the sink's surface since reaching the sink could increase the risk of touching the edge which is contaminated. Next is we're going to remove our jewelries. Since microorganism could lodge in the jewelry. So next is we're going to turn on the faucet and adjust its force to ensure the proper flow for safety, hygiene, and control. So now we're going to wet our hands from the wrist and our fingers pointing downwards. We're going to keep our hands and forearms below the elbow during the hand washing so that the water could flow from least to most contaminated area. Okay, next we're going to check the cuticle, the hands, forearms if there's any signs of abrasions, cuts or open lesions since open lesions could harbor a high concentration of microorganisms. Now we're going to put a good amount of antiseptic or hand soap and lather it thoroughly. Now for about 15 to 20 seconds, we're going to rub it in firm and circle motion. Rub palm to palm. So it is to ensure that we're going to remove the germs, the microbes through friction and coverage. So next is we're going to rub the palm using the back of our hands for at least 5 times each, vice versa. So it is to ensure that hard bleach areas and the fingers would be clean. With the fingers interlaced. And also remember that we're going to keep our hands low or down. Okay, with fingers interlaced again. Fingers interlock. We're going to interlock it so that again all the hard areas can be clean. Now we're going to rub the back of our fingers in a circular motion. Next, we're going to rub our thumbs. Okay, so rotationally, we're going to rub in a forward and backward with our fingers clasped, especially or precisely our right hand and our left palm, vice versa. Okay, now our wrists rub. Okay. Now we're going to rinse and we're going to check if there's any remaining dirt or soap. Okay, this ensures that there's no residue and our hands are all clean. So now we're going to dry our hands using a hand towel. Okay. Starting with the most clean area, which is our fingers. Okay. Now, we're going to turn off the faucet using a hand towel so that we could prevent the transfer of microorganisms. So if we touch the faucet, then we're going to perform again from step 1, the procedure, since your hands are contaminated.